I'd like to move next to someone who is actively driving change, for nurses and systems, and that's Deidra Heuring. So please take it away, Deidra.
Good morning, everyone. I want to echo my gratitude in thanking you for joining us today. I appreciate that you're taking time out of your day to follow my presentation. I'm Deidra Heuring. I am one of the 12 Johnson & Johnson Nurse Innovation Fellows, and I'm also a practicing staff nurse in the St. Cloud Hospital Post-Anesthesia Care Unit. And I know you're all wondering, the weather report today is a balmy 25 degrees, so we're out of the deep freeze for today. So I'm going to share my project, but I'm also going to share the Journey Fellowship, the Fellowship of the Journey. And it actually began in the late summer, early fall of 2019 with a call from Rebecca Love from Nurse Approved. I'm not going to lie, I almost hung up on her because I thought it was a prank phone call. The thoughts were louder of, oh, it can't be me. She made a mistake, they'll figure it out. And I soon came to learn that those are common thoughts in what is called imposter syndrome, and many people experience it. But with the help of the Center for Creative Leadership, especially Lynn Flick-Cooper, I learned you can get past those thoughts and promote your vision. So like the turtle, I could identify. I had a strong vision of what I wanted to do, but I felt a little timid in stepping out and saying too much. So when I settled into the fellowship, I had 3 goals. One was to learn new personal skills in innovation, entrepreneurship, and policy change. I wanted to solve a problem that was near and dear to my heart and my community. And mostly I wanted to share the fellowship opportunity with my nursing colleagues back home. I wanted to share the blessing. So before I start talking about the problem, I just wanted to put up a trigger warning. As I talk about the highlighted problem, it may be a trigger for some of you that are viewing. So please take care of yourself if it is so. The problem I focused on during my Johnson & Johnson Nurse Innovation Fellowship was the need for increased awareness and access to specialized professional education on perinatal mental health disorders. These are also referred to as PMH-C, perinatal mood and anxiety disorders. It's not the same as just postpartum depression or even the baby blues. For the purpose of our discussion today, perinatal, we're describing the conception through the first year after giving birth. The mood disorders are depression, bipolar disorder, and postpartum psychosis. Anxiety disorders include generalized anxiety disorders, panic disorders, OCD, and post-traumatic stress disorder. And then ultimately, I wanted to help improve access to this specialty care for all my parents in my community, and even more rural areas, as that's whom we serve in our system. A little bit about the background information. Incidence is as high as 1 in 5 out of 7 women, and specifically 3 out of 5 women of color. And even 1 of 10 men will experience a perinatal mental health disorder. And of those who actually have a positive screen, who get screened, less than 25% will receive professional treatment for it. We hear about maternal mortality in our country, and we don't have very good statistics as we're a leader in maternal mortality amongst countries similar to ours. What we don't hear about is that maternal death by suicide during the postpartum period or overdose is the second leading cause of maternal death. This is because it is not included in maternal mortality or morbidity statistics through the Center for Disease Control. It's classified instead as a pregnancy-associated deaths. So many of those deaths are put into a different category and remain silent. When left untreated, PMAD's cost estimate is about $14 to $18 billion. However, you cannot put a price tag on the loss of a parent or the loss of a partner to a surviving parent. There's lack of professional and public awareness to the existing professional certification in perinatal mental health that was started in 2018 by Postpartum Support International. So what I wanted to do was focus on training to nurses. I wanted to make this certification available. However, it's not listed as a magnet approved certification, and magnet hospitals are credentialed through the American Nursing Credentialing Corporation. My background is in hospital nursing, and so I wanted to focus on magnet hospitals because they have an emphasis on a commitment to professional development and continuing education of their nursing staff. Many will offer financial reimbursement for the exam fees or the prep fees, or at least build in the time within their FTEs to take the required courses. So that's the nature of the problem. What's my solution? So I knew I needed to become part of a community, and I wanted to build more community in my area. So I had to find out who was doing the work in my town, in my state, nationally, and now even globally. Who was the network? Who was passionate about perinatal mental health, and who was doing the work? Who needs the work? Who are the end users, and what is it that they need? And then what is it that I could do? I decided to partner with Postpartum Support International, or PSI, as I'll call them. It's a nonprofit whose mission is to promote awareness, prevention, and treatment of mental health issues related to childbearing in every country worldwide. The specific tangible goal I knew I could work on was to help PSI apply and obtain national accreditation of their PMH-C certification program through a national credentialing board. And so we choose the Institute of Credentialing Excellence, which in healthcare is the National Commission for Certifying Agencies Division. There's a lot of acronyms in my presentation. I apologize for that. But accreditation is the process by which certifying our educational programs are evaluated against rigorous set standards by an impartial third party to make sure and evaluate if that certifying program meets those stringent requirements. Especially in healthcare, this is important as a program accreditation ensures the health, welfare, and safety to the population or public in which that program serves. Research has also shown that it improves clinical outcome. After we get that done, I will follow up and submit the PMH-C for public recognition into the American Nurse Credentialing Corporation for magnet inclusion in their demographic data collection tool, and ultimately expand the PMH network in my home community. Sounds easy, huh? Best laid plans, and then, right? So like everything else, COVID required us to pivot and be flexible in the J&J Nurse Innovation Fellowship. Yep, that's me. I'm trying to chase COVID and get rid of it. There was so much technical writing in my project, I had to be a little creative here to make sure you're all paying attention. The point is, we were all doing our part within our work home organizations while working on our J&J projects. I just want to call out how truly remarkable my fellow colleagues are. So with this slide, if you're feeling a little bit overwhelmed and anxious about it, it feels a little chaotic and confusing, then you're really now understanding the nature of my project. It was not a straight linear path, but rather a lot of dips and turns and starting over. But also I wanted to use this slide to highlight how I use design thinking and innovation that is in policy change, practice change, entrepreneurship. It's important to understand the milestones and how they line up with each step of the framework. One, it starts with empathy. It starts with listening and learning to really understand the problem and the needs of the end users, and then to co-create and ideate solutions or prototypes that will help solve the problem. I view this as our first application into NCCA. I was also starting my own personal journey about obtaining the certification in perinatal mental health. 2021, we submitted our first credentialing application, but needed to pivot due to change of process with the American Nurses Credentialing Center, or Corporation, excuse me. So I viewed that as our prototype. We had to evaluate the next route to take, and we began our second credentialing application through the Institute of Credentialing Excellence. Also, May 5th, 2021, I passed the Perinatal Mental Health Certification exam during the week that raised awareness for maternal mental health. I see myself as a prototype for the healthcare system, as I'm the first RN to obtain the specialty certification within my system. In 2022, we're refining this process. We submitted our application this past Sunday into NCCA. I'm becoming a certification board member, and we know that an accreditation process can take at least 4 to 5 months for the commission to review. There's usually follow-up work that needs to be done. In the meantime, I will continue with advocacy. I will continue to mentor colleagues with their own innovation projects in my community. And when we do achieve successful accreditation, which we will, I will follow up with NCCA and Magnet for public recognition so that I can make the education a little more accessible to my nursing colleagues. What is the impact of this project? This will improve access to specialized education to professionals working with parents during the childbearing years. This certification isn't specific to nursing. In fact, it's available to psychiatry, doulas, nurse practitioners, physicians, occupational therapists, and many more. But I wanted to make it more available to the nursing staff. I wanted to build an army. I wanted to increase the number of certified nurses that have this education within my community so that we can expand outreach to more rural areas to provide the care that's needed. And ultimately, I want to decrease the lives lost. The images you see are in courtesy of Postpartum Support International. These are 2 memorial quilts that have the names of mothers, parents, and children who have died by suicide or infanticide as a result of a postpartum mood disorder. With permission from Seth Snyder, surviving spouse and father. At this time, I'd like to dedicate my presentation and work in honor of Dr. Radhika Lal Snyder, one of our own Minnesota primary physicians who cared, provided care, and advocated for women's health, who died postpartum due to a perinatal mood disorder crisis in 2021. A mother, a wife, a friend in her neighborhood, alumni at the College of St. Benedict, and the University of Minnesota, a fierce big red ball player, and a member of Pregnancy and Postpartum Support in Minnesota. Seth, baby Vikram, and big sister Zara, you are in my thoughts and prayers. And I offer my deepest sympathy and condolences to any of you viewing that may have lost a loved one in a similar manner. As I had mentioned, a third goal of mine was to share this opportunity of this fellowship with my nursing colleagues at my Minnesota home community, whatever way I could, whoever would listen, because the fellowships like the Johnson & Johnson Nurse Innovation Fellowship are rare for staff nurses. And I wanted to bring my colleagues along the journey in whatever way I could. So through participation in Hack for Health hackathons, supporting colleagues with their nurse innovation projects in my community, and supporting new nurses beginning their career amidst a pandemic, I tried to help other nurses see themselves from the innovative perspective, as they truly are, innovators, although rarely viewing themselves as such. These folks were truly inspirational and helped me during many of the pain points during my project journey, and I thank you. So next steps, and this journey continues. As I had mentioned, the PMH-C application was submitted this past Sunday. We await their review and will follow up with necessary requirements. Then I will submit to NCCA and Magnet for inclusion in credentialing in their demographic collection tool. I'm planning on scaling up this project as certification becomes more accessible to nurses in my community and work to increase the more PMH-C personnel. I will continue mentoring, advocating for perinatal mental health during the postpartum period, and work towards policy changes. What has changed from this fellowship experience is my perspective. I don't see that turtle as hiding anymore, but rather a little weathered, tough and sturdy though, better equipped for the endurance of a long process that can happen with policy changes. It's not quick nor easy, but we will get there. Deepest thank you to Johnson & Johnson, Linda, Michelle, and all the staff, Nurse Approved, Rebecca, Noah, Nancy, and the Center for Creative Leadership, Lynn. Thank you for the opportunity and support of the Johnson & Johnson Nurse Innovation Fellowship. To my other fellows, you inspire me and you're amazing. Thank you to PSI, especially the certification program personnel, Wendy Davis, Bertie Gunyon-Meyer, Jessica Peterson, and Apple Sepulveda for your dedication to this work. Finally, thank you to Pregnancy and Postpartum Support Minnesota and my employer, Centricare, for encouraging with the experience. Thank you for giving this wild card a chance. At this time, Noah, I'm happy to answer any questions.
Deidra, thank you so much for making such an incredible contribution and doing it with such tremendous leadership. I know we have to move these along a little bit. We can circle back at the end. We can circle back at the end for questions. But Jen Wallace submitted a question that I think is really apt and kind of points to some of what you've accomplished in part by making yourself into the prototype for your healthcare system, and leading along the way and supporting so many others and bringing them forward. So, she says, congratulations on your project. This education and training will help so many women and families, not just improve health outcomes, but it's going to save lives. So I guess it's not completely a question, but it's certainly an acknowledgement of your effort. And, we'll circle back at the end for more direct questions for you.